Hello, everyone. As we slowly let people joining from the waiting room, a very, very warm welcome to everyone who joined today's webinar. Wait. My name is Ina Yoga, and I'm the International Coordinator for Menstrual Hygiene Day. I'm working with and for Wash United. I'm your moderator for today, and with me is my colleague Aya Sanbel, who will oversee the chat box. Talking about the chat box, please introduce yourselves, your organization, and where you work in the chat box, so we really know who is with us today and we can make the connections necessary. Today's webinar is part of the WASH session series, a series of virtual events for the humanitarian WASH sector, but also beyond WASH, of course, on a range of subjects, which is hosted by the German WASH Network and is funded by the German Federal Foreign Office. WASH United is really excited to always organize the annual session on menstrual health and hygiene. In 2023, we hosted a WASH session on menstruation education, and in 2024 on Menstrual Hygiene Day preparations. And we're happy to share also the link to the previous recordings with you in the follow-up. For this year's WASH session on MHH, we want to look into innovation in MHH, a subject that is not so much talked about, but is of course very, very important to look at. And we hope to share with you and showcase some of the latest innovations in menstrual health and hygiene, share some of the lessons learned, and discuss with you on scaling up, adaptation, sustainability, and where you see the need for innovation in MHH. For this webinar, we have a really fully packed program, starting with opening words, and then we have about 5 presentations of 10 minutes each. So it's a really rapid and insightful session today. And I know everyone has a lot to share. So this will be more like a conversation starter, and I hope you join the conversation as well during the Q&A and in the chat box. So I will be strict with the time, and I will introduce every presenter before we start. So without further ado, I would like to welcome Chris Houston. He's a principal consultant for Humanitarian Associates. Chris has worked in Papua New Guinea, Nigeria, Ethiopia, Turkey, Syria, Lebanon, Nepal, Jordan, Pakistan, and Yemen for Médecins Sans Frontières, the Red Cross, and the World Health Organization. So you can see he brings such a geographical overview. In 2018, he launched Grand Challenges Canada's Humanitarian Innovation Program. So it's really, I'm really excited that then he brings us his opening words around innovation. He's also the principal consultant for Humanitarian Associations, a Canadian organization that provides advice on humanitarian innovation. His team recently completed an 18-month research project for ELRA, focusing on how to scale innovations in a rapid onset humanitarian emergencies. And the case studies he researched include Oxfam's use of Remy's menstrual hygiene products in Gaza, from which you will hear later. And because Chris is a journalist and he teaches also at the University of Toronto, I think he can really kick us off with his opening word around innovation in humanitarian settings, and particularly for menstrual health and hygiene. Over to you, Chris.
Thank you. If you ask any humanitarian if they think their way of working could be improved, I predict that they will say yes. And yet, if you ask them if they're a fan of innovation, they're often skeptical. And that might seem paradoxical because most humanitarians innovate. In fact, humanitarians are frequently, commonly finding new ways to solve problems. Yet, skepticism of innovation is widespread, and that's because the word innovation seems to have changed in meaning. And in the minds of many, innovation has become code for high-tech solutions imposed by annoying people from faraway places that nobody asked for. So I'm happy that today we're going to be talking about what I think of as real innovations, good innovations, things that people want and things that people need. My message, and thanks for the introduction. Yeah, I've been working in the innovation space for a long time now. My message to people is don't choose innovation for the sake of it. Innovation is a mechanism and a tool to get people what they need and what they want. I'm going to give you two pieces of advice, and I'm going to identify four problems that surround humanitarian innovation. The first piece of advice is the most essential one. Pick the right thing, work on the right problem. Successful innovation is about choosing the right thing to solve a problem. It's less about trying to fit in some new fancy thing, and it's more about taking the time to identify what people need and what people want. The second important thing is adapt to the context. Once you've chosen the right thing, refine and consult and get the idea right, test it and pilot it and learn and adapt and gather evidence and persuade people about your work. Now, the four problems that I want to identify, one is the whole system is deeply, deeply unfair. Innovators have a massive advantage if they're from one of the wealthier countries that tends to fund humanitarian action. These donors in the high income countries find it easier to fund ideas that were created in their own country. They find it easier to support ideas that are from people who speak the same language that they speak. So every system of inequality exists and is some way magnified in the humanitarian innovation setting. The second challenge that people need to face is that humanitarians need to be aware of an issue to try and use it. And so, like, for that to happen, innovators need to attend conferences, they need to network, they need to have marketing budgets. And the people who fund humanitarian innovation, they are often really uncomfortable with spending money on things like sales and marketing. Humanitarians themselves are a bit inconsistent. I've worked in the humanitarian system long enough to know that there's a lot of people that in the humanitarian system that are really skeptical of people who work in for-profit spaces. They see that as unethical, and yet the same people drive around in Toyotas with IBM laptops, and all the agencies pay for-profit accounting companies, and they buy the construction material from for-profit entities. And somehow, the normal activities of humanitarianism absolutely get things from the for-profit sector. But when it comes to trying new things, suddenly there's a skepticism of anybody that's not working in a non-profit situation. So people need to be aware of new innovations, and that means having a budget for a website, for travel, etc., etc. A third issue that is prevalent in the humanitarian space is that everybody thinks that we're all very evidence-based people, and that humanitarians are driven by facts and data. And facts and data are, of course, important. People need to be able to assess what works and what doesn't. Yet we are inherently emotional animals. We are persuaded by stories, and to make change in the humanitarian innovation space, you've got to be an expert storyteller. Partnerships are needed between innovators and humanitarian organizations in order to make change in the system. And the fourth problem is that donors tend to fund things for 1 or 2 years, but changing a system, changing the humanitarian system, is an endeavor that's going to take 10 to 20 years. As this relates to menstrual hygiene, there's a major problem, and that is that humanitarians, if you ask them what they're all about, they'll say it's about saving lives, reducing suffering, and restoring dignity. And of course, menstrual hygiene ticks all three of those boxes. It does save lives, it does reduce suffering, and it does restore dignity. But the dignity thing is really important, and yet humanitarians, I think, have lost track of the dignity piece. It seems to have drifted off the agenda. Today, you're going to hear about menstrual hygiene in several contexts, including Gaza. Gaza is, of course, a place where the humanitarian system has desperately failed. It's failed in many ways, including in the protection sector in particular. Um, to those that run successful programs, despite all these challenges, I commend you. We need this work so much. The challenges are daunting. A lesson that I learned when I was working for Médecins Sans Frontières is when you face a problem the size of a mountain, your job is to grab a shovel and start digging. So as a skeptical person, I want to express my appreciation for, and my very high opinion about the work that Remy does that Oxfam does with Remi's product in Gaza. ELRA's funding of Oxfam to use Remi's product in Gaza is something that I've been researching, as Ina mentioned, for 18 months. The project's wonderful and I love it, and we need more of this. This is the type of innovation that we need. It's needs-based innovation that Palestinians care about, and please do more of this. Thank you.
Thank you, Chris. And there's a lot of key slogans that are so important that you shared. We need more innovation, but pick the right thing, adapt to the context. And I'm glad that we hear actually across several countries how they picked an innovation and adapted it to their local context, being it Remi underwear, but also being it sanitary pad dispensers or reusable pads. So we have a packed program. So without further ado, we start with the first presentation. So I'm quickly sharing my screen so you know who is coming next. And welcome to everyone who joined us just now. We have a really also wonderfully full attended webinar today. Great. So Nour Shoker is the Public Health Senior Officer at Oxfam in Lebanon. She is a recognized professional focused on driving critical public health intervention in complex operational environments. She possesses over 11 years of strategic hands-on experience in the design and field implementation of integrated WASH and health programming, including her specialization in leading, designing, and overseeing the piloting of critical MHM project activities. So she will present to you how the period underwear, but also the scoping of the menstrual product markets, what are the insights of their project in Lebanon. Noor, over to you. I stopped sharing, so you can share now.
Hello, everyone.
Hello.
Thank you, Ina, for the introduction. Now I'm gonna share my screen. Can you stop sharing because I can? Oh, okay. Try again. I'm not hearing you.
Noor, do you have problems sharing? I wonder if
Yes, your screen is on mine. I can't share. Still sharing.
It says I stopped sharing. Wait, I just end my show.
Okay.
Okay, I changed the settings, so you should be able to share now.
Yalla, I will.
So in the meantime, yeah, I think it should come now. Is it coming? Noor, can you? I mean, we tested it before, so sorry for this. I don't know what happens now.
I only can see your screen.
Okay. Noor, then let me share your slides. I'm so sorry, so we don't keep people waiting. How about you? What do you see? I see you now. I don't see any screen. You don't see any screen?
No, can't.
Okay. So I share now your presentation. 1 second.
The final version?
Yes.
Yes.
You should be able to see it now?
Yes.
Okay, and let me know when I should skip the slide.
Okay. Today I'll be presenting some key findings from recent reusable MHM research and key outcome from Remi pilot. Next. Lebanon.
Second. Oops. Yes. Why is it not working? Here. Now it was too quick.
Yes. Okay. Lebanon faces multiple crises that resulted in MHM challenges for both reusable and disposable MHM options. As for the disposable one, it's not sustainable. They are unaffordable due to economic strain. They trigger environmental crisis in specific solid waste management gaps. We have funding shortfalls, donor fatigue, difficulty sustaining the frequency of distribution of kits. As well, also for the reusable MHM product faces multiple barriers as water scarcity, stigma, fear of being seen, washing, and drying. Cups are widely rejected, and we have low adoption rate due to small market penetration, dependency only on NGO distribution. And lastly, low users retention driven by poor material quality. For that, Oxfam in Lebanon decided, next, For that, Lebanon and Oxfam decided to introduce an innovative pilot, REMI period underwear, which is a washable, reusable menstrual product with antimicrobial absorbent core, with a long lifespan, which reduces financial burden. It also supports sustainability by reducing menstrual waste. It also includes a washing and a drying bag, which is our enable water-saving cleaning in low-resource settings, and provide a discrete design for privacy, directly addressing the fear of stigma of being seen, washing, and drying. Next. Oxfam engaged with 100 participants for both nationality, Lebanese living in Tripoli and Syrian women living in informal settlement, in REMI pilot, and track the impact. Next. Based on users' feedback, the majority are still using the underwear and found it comfortable with high satisfaction on its absorbency, with no leakage, and value it for nighttime use. It also improved impact in performing their daily lives and lowered their monthly expenses. Most of them adopted REMI as their main menstrual product, like for Lebanese and also for Syrian women, with different users pattern based on individual needs, flow intensity, and daily routine. As well, they use it as a hybrid user, combining REMI for home night use with disposable when they go outside, outdoors, heavy flow, or wearing both together for extra protection during outside physical work. Next. And if the product is available and affordable, REMI would be the top choices for both Lebanese and Syrian. Additionally, the washing and drying bag played as enabler factor for facilitating hygienic, water-saving wash-dry routines and maintaining privacy and reducing stigma. A general note, the findings are based on a small pilot sample, 100. Border evidence will be merged from the other project, ELDRA, with the 2,132 REMI kits were distributed across diverse community in Lebanon. Next. This is not the last version of Power.
It is. It should be. So I changed it to the one that you sent me the last. You can talk if you want to have more. Noor? Noor, we can't hear you.
Now?
Yes, now we can hear you. Yes.
Okay. This is not the last version. I sent it back to you.
Yeah, I understand, but I think this is the one that the latest I saved.
Did you want me to share my screen?
Well, we don't have much time, but we will send to the participants your latest slides. So you can talk about it.
Okay, if you don't want to share it, I can speak about it.
Yeah, exactly.
Okay. Finally, the time has come to translate our key conclusion generated from MHM reusable product research and from the RIMI probe into actionable steps for scaling up distribution and move beyond one size fit all by offering diverse high quality MHM product, including reusable pads, period underwear in various sizes, reduction of stigma taboos by including drying and washing bag when using reusable product, enhancing availability and accessibility of high quality product to advocate for period underwear global standards, enhancing community engagement and consultation as it is the key factors for all programs, assuring comprehensive training of an innovative product for all staff and users in boosting an early adoption, adaptation of our monitoring tools when using innovative products. Lastly, the RIMI pilot shows that sustainable MHM is possible when the solution is tailored to address the core challenges of affordability, environmental sustainability, and most importantly, user comfortability and privacy. Next, thank you for listening. For further information regarding the MHM research or the RIMI pilot, please contact me. For further clarification on request or additional information on the RIMI product itself, please contact Emily. Thank you.
Thank you, Noor, and apologies for the technical challenges. And if you have a question to Noor already, please use the chat box. We do have a bit of a Q&A afterwards, but I think using the chat box now is always great. So I stop sharing now. And now we turn over to Gaza, where Nour Elbaba from Oxfam is also going to present. Noor, do you want to pull up your slide while I introduce you? And I hope this works better now.
Thanks, Anna. I prefer you can share my slides because the quality of the internet here in Gaza.
Yes. 1 second. This one is... 1 second. Because I closed my presentations. Okay, while I present you, I'll pull up the presentation. So Nour Elbaba has more than 15 years of experience working with various organizations such as the Youth Empowerment Center, Palestinian Environment Friends, Secure Family Relief Funds, and since the last 18 months works with Oxfam as a public health promotion officer on leading the innovation project using RIMI menstrual products within their programming. Nour specialized in WASH, public health, and emergency response programming. She is passionate about community health, women's empowerment, and sustainable WASH solutions in humanitarian context, and enjoys designing creative public awareness campaigns to make health education engaging and accessible. So I think you should see my slide, but I need to skip to the first one. Over to you, Nour. We're looking forward to hear from that. You can see it, right? No?
No, until now, no.
I need to share my screen 1 second. I have your presentation open, but I need to share it. Okay, 1 second. That was a bit multitasking here.
No problem, yeah.
We share this one, and now it in 2 seconds it should appear.
No.
Slowly. Yes.
Yeah.
Okay.
Tamam. Thank you. Hi everyone. As Anna introduced me, I am Nour Elbaba, PHP officer from Gaza. And let me take you through a journey of how we piloted an innovative in menstrual hygiene during this war. As you know, because period doesn't pause in emergency. And I want to tell you that innovatives are often done when the environment is favorable, mostly in stability, at least some form of it. When we have ample time to test and try, so many challenges, as you know, basic needs was daily struggle still is overcrowded shelters and collapsed wash services and no access to safe private spaces for women and girls for MHM or MHH and scarce materials and no disposable products, especially at during the war and at this stage of ceasefire. Please next. As you see on this slide, we are talking about the implementation stages of this project, and what we did that even in the middle of choice, we didn't rush to distribute. Oxfam and partners first conducted assessments with women and girls to understand whether they would be open to trying these new products or not. We explained the components, listened to their feedbacks and their expectations, and conducted the gender and the protection risk analysis. We also held sessions with men and boys to address the stigma and taboos around menstruation, because menstrual hygiene isn't just a woman's issue. It's a community issue, as you know. Also, distribution consultations and BDMs were carried out both in person and remotely during the war, depending on access and safety. Easy step from design to feedback was shaped by the voices of those we aim to serve. Next, please. As you see here, okay, we have reached 5,000 women and girls with menstrual hygiene kits, but the need is in millions. Period underwear was a completely new concept for women in Gaza. This is what I want to focus on here, who were used to disposable baths with the war disrupting markets and the blockades worsening. We know access to menstrual products could become even harder. As wash practitioners, we often focus on the product itself, but reusable items bring new challenges. As you know, washing, drying, and privacy issues. That's where Remy's innovation stood out. The underwear came with a discrete washing bag that uses less quantity of water to save the quantity of water, and the mesh drying bag. It's a small bag for drying these underwears that helps maintain privacy in crowded shelters, as you know. Our goal was to offer high quality, dignified options for those targeted women and girls. So we paired the underwears with a complementary hygiene kit. It's a small kit that included disposable pads, giving women the choice, and they used that choice. Some preferred the underwear only, and others used both depending on their flow and comfort. When we are talking about the prices of sanitary pads, the prices is very high. These women didn't have to worry about how they would manage their period while trying to survive. This wasn't just about the products, it was about restoring dignity in the most difficult time. And also, as you can see in the slide, the inline results reflected their full satisfaction about the reusable products. Next, please. Here we are talking about the challenges that remain stark. Scarce water, overcrowded shelters and latrines, repeated displacements until also, even though after the ceasefire there is continuous displacement between north and south, because families searching for a suitable place for living. Even those who received kits may have lost them while fleeing or during attacks, and while they are moving from area to area. Since the ceasefire, humanitarian aid has started to enter, but the pace is slow, as you know. And access remains restricted. Oxfam currently has 1,800 menstrual hygiene kits stuck in Amman warehouse, waiting for clearance. These are high quality supplies that women urgently need. Also, period underwear still lacks formal standard, but the voices of women speak volumes. Also, I want to say something is important. Our own female public health team here in Gaza tested the product before distribution because we believe in promoting only what we ourselves would use. This is our commitment to continue listening, improving, and advocating. We need unrestricted access to menstrual hygiene items. We need dignity to be central in humanitarian response, and we need your support to make that happens. This is the final slides. We worked within a lot of organizations and wanted to say thank you on the image of Marwa. Just to highlight, there is a video here gathering the testimony of one of women using the products people during our projects and can watch in their own time and in your own time. And last slides is want to know more, please reach me. Tamam. Thank you.
Tamam. Noor, very much thank you. I think we all feel you about the situation in Gaza and how hard and how much struggle this is for you as partners, but also, I mean, especially we think about the women and girls in Gaza right now, even if the situation at the moment is a bit clean. So for every question to Noor, please use the chat box right now. And also we will share the video with the reporting to all participants. Please give a warm thanks to the work in Gaza, to Oxfam.
Thank you, Anna. Thank you a lot.
Other partners who are struggling, and yeah, we know the challenge, as you said, it's really about dignity, and it's really echoing what Chris said before. Here are your contacts for those who want to contact you. We'll share them as well. So I am closing this presentation for you because the last presentation around Remy underwear is now going to Vanuatu, a very completely different region, but we wanted to really add it because it really works with women and girls with disabilities. So a very different perspective. And then as Chris also said in his opening words, adapt to the context. So this context now is a very different context, same innovation, but different context. We had a presentation from the Vanuatu campaign in the 2023 webinar on the awareness component. So that you can rewatch the presentation of Sue Cavill on the awareness campaign from 2023. We'll share the link. But today's recorded message from Chloe, because she's in Australia and the different time zones, is really about their learnings with the period underwear as a solution for women and girls with disabilities.
Hi everyone, my name's Chloe Morrison, and over the past 5 years, I've been working closely with World Vision Vanuatu and Remy, as well as our partners at the London School of Hygiene and Tropical Medicine and the Vanuatu Society for People with Disabilities, to support women and girls with intellectual disabilities to manage menstruation more independently and with dignity during disasters in Vanuatu. Now, for those of you who may not know much about Vanuatu, it's a small island state that is frequently ranked one of the most vulnerable countries in the world to the impact of disasters and also climate change. So it's very much at the forefront of experiencing disasters more frequently and at greater severity. Part of this work has been the Nour campaign, which, as you can see on the screen, is a menstrual health behaviour change campaign. I won't be going into too many details about the Vanuatu campaign today because I believe Dr. Jane Wilbur from London School has already shared about the Vanuatu campaign in this forum. But today, what I'll be talking about in more detail is another element of the work that really evolved as we started to work specifically with women and girls with intellectual disabilities in Vanuatu to improve their menstrual health. And that has been the importance of having access to dignified and appropriate menstrual materials, especially in emergencies for women and girls with intellectual disabilities. So, as background, earlier in 2019, research conducted by World Vision Vanuatu and a host of both in-country and international partners had found that women and girls with disabilities were nearly twice as likely to miss out on social events when they're menstruating compared to women without disabilities. And the leading reason for why this was because of fear of leakage with their menstrual materials. Now, as we were delivering the Vavanua behaviour change approach, we discovered a new problem that perhaps we hadn't been anticipating, and that was that reusable pads, for those of you not familiar, they typically have a press stud to attach the pads and keep them firm and secure in underwear. And these were very difficult for people with intellectual disabilities and impairments to use, people with physical impairments, those with vision impairments, and also for carers who had impairments as well to support young people with disabilities to manage their menstruation as well. And also similar to cloth and disposable pads, this could also contribute to discomfort for people with sensory problems as well. So we started off as a behaviour change approach, and as we were working through this, we started to realise that actually there was work to be done as well in supporting women and girls to have greater access to different or improved menstrual materials as well. So enter REMI. REMI at the time, both at the original project was funded under Elra's Humanitarian Innovation Fund, as was REMI's work here with microbial period underwear. And REMI is a social enterprise that's based in New Zealand, aiming to provide sustainably and culturally appropriate menstrual products for those most in need. And you can see here most recently, REMI have also done some work in Gaza, among many humanitarian settings that they've worked in the world, including Vanuatu. So we first distributed period underwear in Vanuatu through World Vision Vanuatu in 2022 with women and girls with intellectual disabilities. And following the success of this small pilot, World Vision Vanuatu has also distributed the period underwear in a larger scale cyclone response for both women and girls with and without disabilities in 2023. You can see there's a whole host of, I guess, benefits to the period underwear. It's highly absorbent, it's leak proof. As I said before, leakage was a real fear of a lot of women and girls with disabilities. It's hygienic and it's zero waste, which again, if you're not familiar with Vanuatu, Vanuatu as a country has been pushing for zero use of single-use plastic. So this very much fits and aligns with government priorities as well. And perhaps most importantly, it's easy to use. So what we've found so far, as I said, we've been piloting this for some years now, and the results have been really promising. So for women and girls with intellectual disabilities, post-distribution monitoring surveys have found that the period underwear was the preferred product of choice when compared to other options such as cloth or calico, as it's known locally, reusable pads, disposable pads, etc. It had really high acceptability. One of the reasons that we think this is, and from what we've heard from people, is because it just looks like normal underwear. So compared to some other reusable products, you can hang it out and it's not, where there's high taboos around menstruation, it just looks like regular underwear. And it was also seen as easier for carers to use and more comfortable for young people. Now, I've just done some follow-up surveys with households that received the period underwear 3 years ago, and most are still using it. Over 70% of the households are still using it with high satisfaction rates, confidence that the materials won't leak, as well as minimal household expenditure. And we're scaling this up further to explore usage between women and girls with different impairments and across different provinces in Vanuatu with different menstrual taboos. Now, if that's a lot of information in a very short period of time, if you'd like to know more about REMI, please reach out to REMI's founder, Emily. If you'd like to know more about the work specifically in Vanuatu, please feel free to reach out to me. I've also included some publications and research there as well. Thanks so much.
So that was hopefully a very, very interesting insight into the REMI underwear. And I would give us a few minutes for question and answers to our presenters. And we also have Raisa from Oxfam with us, who oversees a lot of those programs. So I'm turning over to Aya, if there are some questions from the chat box that are relevant for our audience.
Thank you, Ina. Thank you for the presenters for your great input. That has started a couple of conversations and questions here in the chat, and I can see that Noor has answered to some of them already, but I would like to share them, and maybe Noor, you can unmute yourself and maybe share the answers with all of the participants. So the first question is from Anne, where she is asking, do you or anyone have any research on the use of menstrual cups in emergencies? So if you have that, Noor, or any of the other participants, you can share that in the chat as well. And then we have the other question from Amelia, who is asking, have there been studies done to consider how effective REMI is for women and girls with heavy flow challenges? I don't know who can answer this question. Emily, is Emily here? No. Yeah. So yes. Thank you, Amelia. We will forward this question, and we hope to get an answer to it. I'm sure we will. And then Johannes also had another question for Noor, which is, are there plans or possibility to produce the reusable MHM underwear and the washing bag locally as a livelihood activity for women and girls? Noor has already answered, but maybe Noor, you want to share your answer by unmuting yourself so everyone can hear you?
Yes, thank you.
Thank you.
About the local market and about the manufacturing of these reusable items, it's a part
Yeah,
already.
it's for Noor Elbaba. We cannot hear you, even though you're
Yeah,
Ah.
yeah. Now you can hear me.
Mm-hmm.
Tamam. Okay, about the
Tamam.
local market and about the manufacturing process of these reusable items here in Gaza. It's already a part of our design for this project, tamam, from the designing stage, but we don't expect what maybe happened here in Gaza. You know, the war is remaining until now, and we have temporary ceasefire, and we have lack access to many materials in the local market. And the situation here in Gaza is unstable and critical until we are in the recovery stage, in the early recovery stage. So we can't decide if we can have this option here in Gaza until we reach permanent ceasefire and end of the occupation here in Gaza, the Israeli occupation, and some of the crossing will open and all materials, raw materials may enter Gaza. Thank you.
Thanks a lot, Noor.
Thanks, Noor. And we're halfway through. I mean, that was super interesting and focused a lot now on, I know, on period underwear. So I wanted to give a chance to you to share your opinion on, as a little energizer. So which area of MHN and humanitarian is in need of innovation? Please use the chat box. So because we wanted to have this as an open question and not as a poll, because you might have very different ideas based on your settings. So we're really curious to hear which area of MHH is in need of innovation. It can be from a component of MHH, being it wash, infrastructure, materials, education, etc. But it can also be a soft approach, like coordination or policy or funding. So, so we're curious to hear your opinion on this. And as you know, ELRA has funded some of the innovations in MHH and Humanitarian, and I think they will listen closely to some of the aspects, and we will summarize this as well. So just before we start with the next two presentations, just maybe one of my piece sent why we designed today's WASH session. So I know that disposal is really a pain to solve in humanitarian settings. And we were trying to see if we include disposal into today's WASH session on innovation. And we decided not necessarily to include it, but maybe design a future session on disposal, because it's just really a dedicated area. But if you have an innovation that you want to share, or especially an innovation in disposal, please do let us know, so we can invite you to the next WASH session. So to my next presenters, they also, I mean, you see that most of the products here today are reusable products because they address disposal. But yeah, we're really looking forward to hear your opinion. So keep it flowing in the chat box while we move now to, and we're very good in time, which I'm very happy about. So that means we can have more discussions later on. We stay in the region, and we have now a presentation from Lebanon by Yara Ibrahim, who is, one second, I'll just introduce you, Yara.
Hello, everyone.
Yeah, she's a soft wash officer with the Lebanese Red Cross in the disaster management sector. She's responsible for leading the implementation of the software component of WASH programs at the national level. So her role focuses on promoting hygiene awareness, community engagement, and behavior change initiatives to improve public health outcomes. She also designs and facilitates capacity building sessions for their volunteers. And then also, she is the focal point for menstrual health and hygiene management, working to strengthen awareness, inclusion, and best practices in menstrual health across communities. And that's why we're very glad that you are with us, Yara. And
Thank you, Ina, for the introduction.
Yeah,
Can you all see my screen?
No, not yet. I stopped sharing mine. So
Okay.
then you should be able to share
Okay.
yours again. I can see it. Can you see?
Can you see my
Yes, we
screen?
can see.
Yes, we can
Yes,
see.
we can see.
Okay, great. So thank you for the nice introduction. So I will be talking briefly about what Lebanese Red Cross does in terms of MHM or menstrual hygiene management. I will talk briefly about the first 2 points and go more into depth on the remaining 2. So first of all, we conduct MHM sessions for the females in informal tented settlements, the Syrian we have in the ITSs, and as well as schools. And along these sessions, we distribute MHM kits in both the ITSs and schools. We have installed sanitary pad dispensers in our schools, and we have developed a token system for the girls. And we are piloting or under pilot of a session, MHM for boys, or titled Understanding Personal Hygiene and Menstrual Health, a guide for boys during puberty. So first of all, our MHM session covers several topics, such as the female reproductive system, understanding the cycle and the phases we experience, what signs do girls expect to experience during menstruation. We clear the air around some common misconceptions and myths regarding menstruation and what materials they can use, and ideally, what's the characteristics of a safe and private latrine to use for MHM or during MHM, during menstruation. Here you have pictures of our volunteers conducting the sessions in the ITSs. followed by the distribution of the kit. The kit is called مجموعتي, which translates to my kit. We will talk about the components later on. And here our volunteers are conducting the sessions in schools with the distribution. These are the components of our kit. It includes reusable pads, disposable pads, towels, a rubber heat bag to control pain, underwear, and an intimate watch. This is an old photo. We have removed the wash since recent studies show that it is not healthy and it's not beneficial for down there. These are the famous dispensers. We have installed them in our schools. As you can see here, we changed the pads. Actually, these pads were the first things we used. These are not individually wrapped, so we exchanged them for individually wrapped pads for so the pads are clean and more hygienic. In the school, each girl will receive 3 tokens per month, and they can use it or not based on their needs. And every month we replenish these tokens for the girl. Let's say if one girl uses 2 of her tokens in 1 month, the next month we give her 2 so that she still have 3 tokens. And as a backup system, we will agree on a discrete place. It can be the nurse's office or a trusted teacher where we will put a reserve of the tokens in case some of the girls forgot her tokens or there was an emergency. So they can resort to the nurse or the teacher and get their tokens and get their pads. The dispenser is located in the room where the female toilets are there. So we have several stalls. We can have up to 5 or 6 stalls, and the dispenser is there, so only the girls can see this and only the girls can use them. And yeah, these are the dispensers. Now we come to the MHM session we created for boys. We wanted to be as inclusive as possible, and we wanted to try to remove the stigma we have around menstruation or blood or periods or pads or whatever. And even though half of the population actually menstruates, it's still a very lonely experience. So we wanted to lessen the burden of menstruation on females and include boys with this, include boys in the topic, and also give them something for them to learn during their puberty. So what we did here, we followed the same system we did in the MHM session. We started with an overview of the male reproductive system. We then went into the physical and emotional changes that happen during puberty, followed by the proper hygiene practices to adopt and behavior to adopt during puberty. And here we need to focus that we wanted to also eliminate the stigma that boys don't care about their personal hygiene, that boys are dirty. So we made it as interactive as possible, as fun as possible. After the hygiene practices they have to adopt or they should adopt, we introduced the things that happen during puberty for the females. We talked about the menstrual cycle. We talked about the female reproductive system. We wanted to share with them what myths and misconceptions they hear from their community and how to correct them, and why it is important for them to support girls, whether they're friends, their mothers, their sisters, their girlfriend during this time. And then we moved on for also the features of a safe and hygienic latrine, because this should not be exclusive to girls. This should be inclusive to both girls and boys. Both need a good place, a good latrine to manage whatever they want to manage. And lastly, we will distribute, or we'll let them see and feel the MHM kit and touch the things we use, the pads, the reusable pads, the underwear, and so on. And we will give them a small personal hygiene kit. This session took quite a while to develop, because it was then we sent it to the psychosocial support team we have. They commented on the wording we used, on what activities we will do, on the flow of information, if it's appropriate or not. They put in their comments, we adjusted it accordingly. And then we sent the session to our learning and development team, which then created the proper activities to use during this. The next step for this session is to train our volunteers on conducting this session, followed by a pilot in one of our schools, and hopefully later on we get approval from the Ministry of Education to conduct this session in schools. And we still have the Rose's word, but I think you have the case study for this one. This one is it's very nice. And that's for me. If you have any questions or later on, as you wish. I will stop sharing my screen now.
Yes, thank you, Yara.
Thank you.
I am so glad that you touch upon boys' education because that frequently comes up. We do have an upcoming case study about Rosie's World, the Girls' Education Guide. We also spoke, and it was really interesting, we spoke to Oxfam Lebanon a while ago, and they had quite a challenge in working with boys in education. So they had faced a lot of resistance from some of the conservative community members, and they didn't want to risk the whole program. So maybe you can answer my question in the chat box on how you really ensure that the community is pro or like supportive of boys' education. So that would be my question. Now we're traveling to a very, one second, I share my screen again because now I'm after an hour, I'm pro in sharing screens, as you can see. And our next presenter is now working in a very different country, but we're very glad to have her with us. So this is Evaline Abu from the Uganda Red Cross Society. She's the WASH project officer based in Arua, so that's in the northern Uganda, and she's responsible for coordinating all aspects of WASH program implementation in the Arua Madi Okolo districts and in Rhino refugee settlement, a very well-known refugee settlement in Uganda. She's providing day-to-day insights to ensure that all activities align with the project work plans, donor requirement, and strategic objectives. As while she's focusing on improving access to safe water and sanitation hygiene services, she's really also looking into MHH. And today she's going to present on how they approach MHH in their areas, and specifically through a reusable pad mini factory, and also how they trying to pilot product dispensers. So I'm stop sharing my slide to see if Evaline, you can, second? Yes, if you're able to share your screen, and then over to you.
Thank you so much, Ina. I hope everyone is seeing my screen.
Yes, and if you can then put it into presentation mode, it's perfect.
Presentation mode.
On the bottom is or start the slideshow. Otherwise, if it's too complicated, take it from there.
Okay, then I was looking for the option for presentation mode.
You go on top, there's slides.
If it is okay,
Well, we just go ahead. We don't lose time, so.
Okay then. Thank you so much. Hello, everyone. My name is Abu Evaline. I'm glad Ina has already introduced me. So let me just go straight to our presentation. The next slide, it's the presentation outline. We are talking about the MHM innovation by Uganda Red Cross Society. And then some challenges that we have already encountered, and then the way forward. The next slide, we have a number of innovations that are being implemented by Uganda Red Cross Society. We have set up a mini factory for production of reusable sanitary pads, which is locally within the country. And let me give a little background to this. Uganda Red Cross Society, in partnership with Randall's Charitable Foundation, has set up a mini factory for making reusable sanitary pads. And this followed a research which was done by Ministry of Education and Sport, which established that a large number of girls drop out of school due to lack of sanitary pads. And the factory is manufacturing about 50,000 to 100,000 reusable sanitary pads every year. And so far, 50,000 vulnerable girls and young women have already benefited from this initiative, especially girls in the refugee setting, and then also young women in a very vulnerable group category. Of the parts which are being manufactured, of the 20% of these parts are donated to the vulnerable girls and young women. And then 80% of these parts, it is being sold for sustainability purpose. And I must say that the that have benefited from, they have even reported increased enrollment of school as a part of this initiative. They are not able to stay in school, and this has also improved on their retention.
Evaline, I just need to, oops. I think now Evaline dropped. Let's hope she's back. I just wanted to offer to that I can share her screen so she can save bandwidth. Let's hope she'll be back soon. In the meantime, are there any questions in the chat box that are really good to answer? Evaline is back.
Sorry so much. That was my internet
Connection.
instability. Yeah.
Evaline,
So
Evaline, I wanted to offer that
yes,
I share your screen so you save bandwidth. Is that okay? So you stop sharing and I share for you, so it's when the
okay then let me stop sharing the screen. Okay, I think it's okay. You can
yes, 1 second.
share yours.
Yes, give me 1 second. And we can continue talking. We saw the slides before. So
yes, still about the factory with the theme of keep a girl in school. And so far, a number of girls have already benefited, and schools have already given a very positive feedback about the initiative, where girls are very happy. Parents are also reporting positive feedback that girls are very eager to go to school because they know that they already have the pads. And then above all, there's also emergency sanitary pads already in offices with the senior woman teacher, whereby in case a girl has forgotten with her pads at home, she can easily go to a senior woman teacher and pick one. Another innovation that Uganda Red Cross Society is also undertaking is the construction of inclusive latrine for girls in schools. And these latrines already have a changing room or washrooms in such a way that a girl is able to go and clean up, is able to change, and then go back to class. Unlike before, most of these girls, they would just go back home, they will run to a nearby home to go and clean, or even a nearby well to go and clean and then come back. But with the washrooms already in schools, it has made it very easy for them. And then also we know that after distributing these reusable sanitary pads, with time, it gets worn out. So what is the next option once it is worn out? So we also train the young girls and women to make their own reusable sanitary pads using local available materials. So these girls, after making a number of reusable sanitary pads, they're able to sell others. They're also able to use others. And the ones they sell, they really do it at a very affordable price so that their fellow girls and women can also access it. And then another innovation, which we feel it is worth talking about, worth sharing, it's about a dispenser. This is something that we are looking towards it. It is already in the pipeline. The design, it's already being undergoing approval process. And once it is approved, I think we shall be able to start putting a dispenser. And the dispenser would be for the refugee settlement, especially at transit centers, where we really know that somebody really could have left the home in a hurry, could not have carried enough, and by that time we are yet not able to distribute, but they are able to pick a sanitary product from the dispenser. Ina, please, next slide.
Yes, it's coming. Wait. Once. Why is it not moving? Yet now it comes. You should see the next slide now. Yeah?
Not yet.
Yeah.
Okay, yeah, okay, it is already here. In the photo here, these are the Randall Charitable Foundation, the ambassador, and then the Secretary General for Uganda Red Cross Society during the commissioning of the factory, which I've already given the background about. Thank you so much. Next.
Mm-hmm. 1 second. It's a bit slow. Now it comes.
Yeah, I think the network is not so good.
We have the next slide with the pictures of the pads and sewing machines.
Yes, yes. Actually, this is one of our branches supporting girls in schools to make their own reusable sanitary pads using sewing machine. And on my right-hand side, that's the ambassador to Uganda, Austrian ambassador to Uganda, also visiting one of the sites. Thank you. Next slide.
Mm-hmm. It's there?
Not yet.
Oh, no. Yeah, for us it's there.
Yes, I also want to talk of some few challenges like my colleagues have also encountered. First of all, it's the mindset change, especially from men and boys, to openly discuss MHM issues without stigmatization, and also to be involved in whether it is a training or making reusable sanitary pads, or even putting facilities at home for the girls. We are also looking at the access to quality materials for production of reusable pads. It is a challenge because most of these materials are expensive, and they are also not easily obtainable. And then high cost of production and marketing, competition from other suppliers, our tailors also who keeps on changing after getting the skills. And then high expectation from the public. They always want the pads to be given freely without looking at the sustainability part of it, which we need to make a little sale for it to be possible. Next, please.
Mm-hmm. Yes, it's there. The way forward.
Oh, yes. We also have some way forward that we really hope that when we put in place, we shall be able to overcome some of these challenges, outsourcing some raw materials directly rather than using third parties, because some of the materials are being provided by third parties, and then cut down the number of employees. We have nearly 100 employees at the factory, but we need to cut down in order to stabilize our operation. And then media teaming partnership, so as that we offer a service also for a service, and then producing quality product, which we are able also to compete in the world market, that our products are really getting a stance in the market. Next, please. So now, like I had already talked about the dispenser, I want just to go into a very brief discussion on this, just few minutes, and then I will be done. We are looking at having the dispenser in public places, And one of the places that we're looking at would be at the reception center, where we normally receive very many refugees entering the country. And always at the reception center, like maybe at the border, there are really a lot of, it's a little bit crazy and people are moving up and down. But I would really hope that the dispenser, once it is put at those transit center, would enable the young girls and then young women to be able to access the sanitary pads even on transit. So now we're also looking at having we are also looking at having a dispenser in schools, because normally in schools, it is normally the senior woman teacher that keeps the emergency sanitary pads. Well, we could have distributed, the girl child will be having some, but there are really those days that you really don't expect to be experiencing your cycle on that particular day. Then it happens, you're in school, lessons are going on, and you can't run back home. So in such a case, they go to the senior woman teacher and pays. But also, there are these scenarios where we're looking at having the dispenser in schools where a girl child can just go to the washrooms and then take it and then use it. And having the dispenser put in the washrooms also addresses the challenge of stigmatization, because now when a girl child goes to a senior woman teacher to pick the emergency sanitary pads, everyone, even the boys, this is where the stigma comes in. The boys would say, and then they would look at them and say, hey, this one is already menstruating, and then they will start stigmatizing that particular girl. But with the dispenser in the washroom, somebody goes, picks it, uses it without anyone even noticing it. And then we're also looking at having it in our offices. We shall put it in all the Red Cross offices across the country, where the female employees would be able to access it, instead of one again going back home or stressing about how to get that emergency sanitary pads at that time. They're able to go pick it and use it, and the problem would be solved. Next slide, please.
I think it's very similar. So I skipped.
Yes, I think now we are all now looking at how to refill, because this could also be a little challenge, how to refill. We are looking at engaging the senior woman teacher, or even at the workplace in offices. We assign one responsibility, one person with the responsibility of refilling this dispenser. Once it is done, they go and refill it. And then our continuous awareness question on usage of the menstrual dispenser, because it is still the first time that we are going to implement this. So we really need a continuous awareness question for people to be able to know how to use it and then not to misuse it. And also for sustainability, especially in schools, once we already installed the dispensers in the washrooms, at least now we know that the schools, they would be able to allocate some budget quarterly basis to purchase pads and then also refill it to enable sustainability to go on. And I think this is the last slide.
It is.
Yeah, thank you so much for your audience and also giving me this opportunity. Any question, comment, it's welcome. Thank you.
Exactly. So I hope it was also interesting to hear from two different dispenser solutions, one with a token and one that you're still piloting. So my question to you is, where do you get the design from? Do you adapt it from existing ones? Are there suppliers who provides them? That would have been my question, how you choose the design that you go for. So maybe Evaline or Yara, you can answer how you choose the design of the dispenser.
Yes, maybe let me go first, then Yara will come. I would also like to really hear so much from Yara, how they've also chosen the choice of the dispenser, because for us we have taken a look at a number of them, but like I had said, that we are still in the which works in our context. We want something which, because many of them that I've seen, they may not be able to control the number of pads being used, but we are looking at something which is able, which the users are able to control the usage. Maybe let me first hear from Yara how they have chosen the dispenser. Thank you.
I think we have suppliers that we usually work with, and then we choose the dispenser that fits our specs and our budget, I guess. So yeah, it's basically based on our specs and budget.
Yeah, because we also have like really low cost, there are low cost solutions, and with the token system, it's a bit different. Okay, so we're fantastic in time. Thanks to all the presenters for their fantastic insights in such a short time. It's really amazing to get the snapshot on your programming, which is so comprehensive, and you provided insights into just a tiny piece of the work that you do. So here we are now, and we're now in a really open session. So you can ask questions to the presenters. And this time, we don't need to use the chat box. So you can also unmute yourself and send questions to the presenters. Or if you have reflections, have those similar innovations like, for example, boys education, period underwear, or pad dispenser, have they worked in your settings or maybe not? So please raise your hand so that not everyone talks at the same time, but please unmute yourself and then you can ask our presenters a question. Yara, yeah, please. And then
Actually, yes, I have a question regarding the session for boys. I wanted to ask if anyone had experience with something similar to this, and if yes, how did it go? Because we still haven't done in school. We are still in the pilot phase. So I want to have some kind of sharing your experience if someone did something similar to this.
Good question, Yara. Use the forum. Anyone who can answer Yara, or maybe Yara, you can also type your email so people can answer you by email if they have some insights. But anyone who maybe has some experience who want to answer Yara here in the group? Ranu, I know that I just point you out. Ranu is one of the really key champions on MHH in India. Ranu, I don't know if you can be unmuted, but what is your experience in boys education? I hope you can unmute yourself. I don't know if that's possible. Nope. Should be. But maybe he's just listening in and can't speak. Vaishnavi, you raised your hand, so I ask you to unmute so you can, if you're able to do this. Yes.
Hi, everyone. Am I audible?
Yes, you are.
Great. So hi, I am Vaishnavi from the organization called Bala. We have a different kind of curriculum with us, and we also have done this pilot project and a good big project with the organization. And yes, so we have a great experience with boys. We, like you mentioned, that you explain pads, and you even boys let them touch the period products. So that's how we also kind of did. And also we have a great activities planned with our curriculum. So it is a great experience because the way we think that boys will react is not actually happens over there. They actually don't know how things go and what MHHM is, and with the emotional connect with their parents, families, and with their colleagues, and even with the girls in the school. So it was a really nice experience conducting the workshop in schools.
Thanks for
Thank
sharing.
you. I think I've seen a video of what you do on Instagram pass around, because I've seen boys touching and experiencing the products. Not experiencing, actually, feeling them.
Oh, that's great. I think, yeah, we are very active on our social media as well. And the project went really well. And that was also our pilot and a big project we have done. And it went really well because we assume that boys will not react well, but it is completely opposite of what we assume. So it really went well with us. I hope I answer your question.
Yes,
Yara.
yes. Thank you. That was very insightful. Thank you.
Thank you.
Hello. Yeah. Thank you so much. My name is Joseph. I do work with the Child and Youth Care Organization, especially in eastern of DRC. As you know, it's the region which is currently facing on some troubles of war and conflict. And I am speaking on behalf of rural communities, especially women and girls, which are in difficult of having access on this kind of kits, hygienic kits. So I would like to express my interest on collaborating with those interveners who have speak about their interventions in different corners around the world. And this is also my opportunity to share with you some experience that we have, because I have more than 5 years working with these communities in little areas where women and girls used to use every month. They used to use dirty clothes in terms of hygienic kits, because they don't have money, they don't have resources so that they can buy every month hygienic kits. So we have worked with them, and because we have realized that most of them are victims of infections, and most of girls drop from school because of being shamed. As they can be in school, they have this kind of behaviors of feeling ashamed, and this affects even their notes, even their performance in schools. That's why I said that I am very interested in seeing that you are doing innovation in terms of helping girls and women to have access on quality hygienic kits, which can be used many times, because we have realized that we have proposed some kind of hygienic kits which are used and many times, but this expose them for infections because their level of property, level of making sure that it's very clean is very different.
Yeah,
but
Joseph, I have to cut you short. Sorry, Joseph, I have to cut you short because we, I know, sorry, it's really valuable information you're sharing, and we really feel the situation. Is there a question to the presenters? A specific one, or do you want to share your email with some specific requests? We can also put you in touch with some organizations working in Eastern Congo, who also work on MHH, so you can team up with them. Is that okay? Or do you have a specific question to one of the presenters?
Thank you so much.
Okay. Joan, you also raised your hand, not only head.
Hello, everyone.
Hello, we can hear
Hope
you.
I'm audible enough.
Yes.
Yeah, so my name is John. Thank you. My name is John from Kenya's Foundation in Kenya. And from what the presenters, all of them have presented so far, it's really commendable. Actually, maybe to answer first, maybe how they engage boys. For us, we also deal with reusables, but for us, how we engage boys, apart from the education, we also give them boxers as a form of menstrual health and hygiene management, because these are things that you find boys actually don't have, especially vulnerable boys. So a question to any presenter can maybe answer, because most of them talked about reusable pads and period panties. So yeah, we also have the same product, but you find we have this challenge where when you go to the field, as Kenyans, we produce our own. It's locally made. It's an empowerment project for vulnerable women in the community. But you find when we do now distribution to vulnerable girls, we get some of the questions. So I wanted to maybe get a view of how you answer such questions that, you know, maybe we can replicate on our own side. Maybe the first one on, I don't know if you guys experience where people talk about their cultural myths and misconceptions and taboos around maybe washing blood or touching blood. Do you guys have the same? Because here in Kenya, there's communities where you find they say it's a taboo to wash. Also, you find others saying airing it out, you know, because when you wash it, you have to air it out in the open. So you find maybe some of the girls telling you, maybe from our community, you're not allowed to air it out where your parents are supposed to see. So they end up airing the product in maybe disguised places, which is unsanitary and can lead to effects. How do you combat that one? So on cultural taboos in terms of airing, also on myths and misconceptions, how do you go about it? And lastly, we know maybe reusables and period panties require water to wash in highly scarce, maybe areas that are semi-arid and arid areas. How do you go about maybe distributing to such areas and ensure, you know, when they get the product, they use it in the right way? I don't know if all my questions have been gotten well, but
yes, Joan, I think the last two ones are super important. They came up a lot of time. So starting with the last one, how do you promote reusable, washable products in areas with water scarcity? Question to everyone. And also, what about drying? Does that create some taboo and stigma issues and so on? So I don't know who want to answer. Raisa, she's nodding her head. Raisa, over to you.
Yeah, thanks for the question, because this is exactly the reason why we were interested about the REI project, because there was not just about a period underwear, super high quality, but it was around looking at washing and drying. When they developed their period underwear in Bangladesh, actually in the garment factory, the women are very pleased with the product, but they say we can't touch blood. We want to be able to wash. And that's where, with some national organization actually in Bangladesh, they developed the washing bag and the drying bag. And this is essential. And then for me, that was being a very big learning. Despite all my time in the humanitarian sector, I realized suddenly, as a wash person, that, oh yes, what about washing and drying? And that is beyond period underwear. That is any reusable product. How do women wash? Well, they wash at night because they can't be seen. They can't be seen by anybody, especially male, in their household. So they have to hide. So that is not acceptable. They should be able to wash whenever they feel like it. And I think please watch the video from Nour in Gaza, because if you talk about a place where there is no water or very low water availability, it's Gaza, I can tell you. So really, their struggle, but a lot of women say actually it was possible. And we did some testing in labs to see like even half a liter was enough for washing a period underwear. So the washing bag is really helpful for not touching the blood directly, to wash it separately. and also to use not so much water. And the drying, in many countries I went to, people say they can't dry their reusable material. So they are drying it inside the house, close to their bed, so it doesn't dry well, then we have infection. So basically we are distributing things that might actually lead to infection. So my plea is really looking at those practices and discussing with women, understanding where the taboos, where the stigmas are. I came back from Somaliland 1 year later, and women are super happy because they say, actually, we dry, it looks like a black square. We dry our period underwear, and actually our underwear as well in general, in a hidden manner, but actually it dries properly. And we can do that in front of our husband or brothers or sons. So I hope that answered your question, but there will be more. We will be publishing more research paper, and some of the learning partners that have been with us as well, like Group URD, also will do that. So very happy to share all the insight. Thanks.
Thank you, Raisa. And it's indeed, you mentioned, it's like the whole chain, right? From distribution to the product choice to then to washing, drying, storing, reusing it again, and disposal at the end. So it's finding out where are the pain points, where like maybe taboos and stigma, very different to a different context. Again, similar to what I can only echo what Chris says. Yes, maybe it is the right innovation, but you always need to adapt it to the local context to understand. I have one more question, and then before we close, Mili. So over to you.
Hi. Thanks very much. Raisa, it's lovely to see you again. I'm just wondering regarding the provision of the washing bags, were there also attempts made to break down the stigmas and the taboos around being able to touch blood? Because this is something we really try and work on with our reusable pads here, to try and avoid having to provide additional bags and accessories that is, just additional materials. I'm just wondering if there was also the education element and that wasn't necessarily successful, and then there was the need for the bags, or whether you think possibly with the education we could avoid having to provide the extra equipment. I'd just love your thoughts on that.
If I can jump in, Ina, I think education, sharing information is very crucial, and I think all the work that other presenters has been also saying around engaging with men and boys. But unfortunately, I think this is a really strong stigma that really is, and it's not just about certain economical class or kind of linked to education. We have seen that stigma in various layers of the community in Lebanon, especially. I'm just talking about Lebanon. So I think, that will definitely take quite some time. And as well, I think the washing bag, also the element was around putting all those items on the side, not necessarily washing with the normal kind of basin that you wash the rest of your clothes. So that was also another added value where we went to that. But I think, here, I don't know if anybody has other insight, but it's quite challenging at the moment and still challenging.
Thank you, Raisa. And with that, I'm very, very... we have such a number of participants who still stay on. So we still keep the room open, but I just want to officially close the WASH session today with a big thank you to all our presenters who have done a really amazing job in sharing about their innovation and their programming in humanitarian settings. And we know if there is a setting that is the least period friendly, it's humanitarian settings and emergencies and rapid crisis. We're going to send you the link to the recordings and all presentation, including the contacts of our presenters afterwards within the next days. So you can really follow up also one-on-one. You can reach us also via these emails. And while this is the last official WASH session for this year, we hope to continue these WASH sessions also in the next year and have more exciting news to share. Yeah, so that is my official thank you. And I also would really like to thank Raisa and Alex from the Red Cross, who really helped to mobilize their team and work at the back end to get such fantastic presentations done, and link us to Chris for his really insightful opening remarks. Chris, again, thank you for just narrowing down in 5 minutes, very concisely, what you learned in the last centuries of work in humanitarian settings. I know you could have done it yourself. So with that, I officially close the webinar, but we're still here. If you have any questions or want to use the chat box, if you have more questions, we still keep it open for another 5 to 10 minutes, as we still have so many participants here with us. So if anyone wants to still share something, please raise your hand, and you can share this with us. Thank you again.